Do you want an exercise, a stretch that's gonna help you combat your knee kiss and reduce knee pain so you can stand better, walk better, and exercise better? Well, I got that stretch for you right now. What's up, YouTube MS Gym family? My name is Trevor Wicken, and I am the founder and creator of the MS Gym, the largest platform for movement, mindset, and education for people affected by MS and other neurologic conditions. So we release videos on this channel quite often, so make sure that you watch this video, you like this video, and then you go and subscribe to this channel so you don't miss out on all the awesome content that we're going to be putting out that's going to help you counteract your symptoms and live a life by design and not by diagnosis. With that, I encourage you to watch till the very end of this video because I always have some special offer for you that will give you an opportunity to come train with us inside the MS Gym. So the major muscle that contributes to our knees falling in like this, creating that knee kiss and creating a lot of strain and stress on those knee joints is this muscle right here, the adductor groups, all right? So I'm gonna teach you how to release these adductors and then how to do a dynamic and static stretch for these adductors to reduce spasticity and give you more elasticity and stretch in those pesky muscles. So what I typically recommend for releasing adductors is a rolling pin. Now this is a TheraBand like myofascial roller, which I don't get paid for mentioning it. I can just tell you that they're on Amazon pretty cheap. You can also just go to your local dollar store or grocery store and just pick up a normal rolling pin and it just does just as good of a job. Now, if you don't have a rolling pin, you can always use your hands and get in and knead out these muscles as well using the techniques that I'm going to explain. So what you're going to do here with this roller is you're going to put that on the side of your leg and kind of tip it down. And then you're going to just roll along the side of those adductors nice and slow. And when you find one of those spots that makes you go, ooh, that's a party spot, all right? That is what we want to break up that party because there is nothing good going on there. So once we find one of those party spots, that is where we are going to roll back and forth, nice and gentle, for about 45 to 60 seconds. Now, as you roll, this is not a power game, okay? You don't want to drive that roller into the muscle and cause a threat response, all right? So it's going to feel a little discomfort, but I would say that discomfort level should be about a 5 out of 10. And as you roll out, you want to feel that discomfort level diminish from a 5 to a 3, or to a 4 to a 3 to a 2, somewhere in that 45 seconds to a minute. How you do that is as you're rolling out, you want to breathe nice and slow. You want to allow your body to relax because that's going to upregulate what is called your parasympathetic nervous system, which is going to counteract your symptoms, which are brought on by your sympathetic nervous system, which is your fight or flight zone. So then we're going to switch and we're going to do the opposite thing, or we're going to do the same thing on the opposite leg. So once you're done rolling out or myofascial releasing those muscles, that's going to upregulate your parasympathetics, which makes your muscles easier to stretch. So what we're going to do here is most people's legs are kind of stuck like this with knee kiss, and we're going to try to stretch them apart. Now, what you want to do is your legs may be locked like this, so you may only be able to get like one single fist in between there and pry those bad boys apart. That may be as much as you can stretch. That's fine. If you want, then like as you get better, you may be able to get 2 hands in there, and that's all you can stretch, and that's fine. Eventually, you're going to be able to push those legs apart, okay? And eventually, you're going to be able to lean forward and get those legs apart even further. And that's really where you're going to know that that knee kiss is going to start to get less and less. So go ahead and put your fists or your hands or your forearms or your elbows or whatever it is between your thighs. You're going to push out. As you push out, I want you to exhale, okay? So take a mini inhale and push out and exhale. 1, 2, 3, 4, 5. Inhale, kind of just ease off of it, but don't sit all the way up. Exhale and push out. 2, 3, 4, 5. And come up. Little inhale and exhale. Come down. 2, 3, 4, 5. Inhale, come up. And come down and push out. 1, 2, 3, 4, 5, and come up. Now it's that long static stretch. Okay, ready? And come down and we hold that for 20 seconds. 2, breathe normal. 3, 4, let your body relax. 5, 6, 7, relax into the stretch. Try to get your body to chill out, get rid of that tension. Try to relax your neck and your shoulders. 11, 12, 13, 14, 15, 16, 17, 18, 19, and 20. Good job, you guys. So that's how you roll. So that's the first part of getting rid of that knee kiss and getting rid of that knee pain, is to release all these super overactive muscles and then get them into a stretch. When we stretch like this, it actually teaches our brain to be more flexible, which teaches our entire body to be more flexible, which leads to neuroplastic improvements in your body's overall elasticity and desire and want to move, instead of protecting itself, staying stiff and rigid. So I hope you enjoyed this. This is an awesome release and stretch combo. I'm so glad that you were here for this exercise. This is just a small sampling of what we do inside the MS Gym. So in this part, we talked about what stretch and release were best for reducing knee kiss. In part 2 of this series, we're gonna talk about a knee strengthening exercise that's really gonna help combat those pesky knees that just wanna stay bent and won't help you stand up. So tune in for that. Furthermore, if you want more free resources just like this one to help you start moving better and feeling better and counteracting your symptoms, check out the links below in the text and click on those and get started.